Okay, so I'll go really quickly through this. So I'm an assistant professor of design at the University of Utah, and trained as an architect, and then started this patient experience project, which hopefully you'll see the connection. So these are staggering numbers that are in our healthcare system, where we spend trillions of dollars, we have millions of procedures, we have hundreds of thousands of physicians, we have more nurses, and the number of people who have cancer, 18.6 million people. But behind all of these numbers, I think in healthcare, are the individual people who are affected by this. The fathers, the daughters, the mothers that no longer remember your name. The great-grandparents that have seen from the time of stagecoaches and other things that have lived over 100 years, near 100 years. These are the individual stories that make up this healthcare. Right? A family that's been devastated by health issues their entire lives. And I think this is something that we all can relate to. It's like taxes. Everyone has had an experience. But what happens when we go into a healthcare system is we're filled with unbelievably diverse types of emotions. Even if it is in one of the best facilities like the University of Utah in the country. People walk in not understanding what is going to happen, who they're going to meet, and what the outcome is. And they essentially give up their lives and walk in to someone that they've met for 5 minutes and go under uncertain if they're going to wake up. And we all have these stories, right? So you have trust, uncertainty. This is the view that you get when you go into an exam room and sit there. What message is that telling you? What does that say about a caring, healing environment? This is what they give you to give every worldly possession that you've come into the hospital with. Put it in a bag and give it away. And put on a ridiculous looking outfit. Right? I mean, it's interesting. And you get some cool booties. But they're not even that cool. If you go to Hotel Monaco, I guarantee you that you're getting better swag there. And you're not paying $50,000 for a visit. This is the view that you get as you're going under from the anesthesiologist, given your life to this particular person. Little aside, I don't know how many of you all are anesthesiologists or no, but those people are the most powerful people in the hospital. They're the ones who are controlling your lives with pharmacokinetics and dynamics and drugs so that these other amazing people can do their job. But that's the view. Is that what you want to remember? 10, 9, there's a bug up in the... This is the environment that is supposed to instill confidence. Now imagine yourself being Native American, living on a reservation, living without electricity, without running water, and you're supposed to go in there and someone asks you about how you feel. It's mind-boggling. This is the environment that I'm supposed to feel okay and comfortable and willing to talk to someone about? And the expectation is these patients should speak up. They should talk. Like, no way. And then make it so you have a particular physician, let's say a pathologist, that walks in and he has 5 minutes he or she has 5 minutes to give you a diagnosis that the cancer that you have, the biopsy is cancerous, and that you potentially have 6 months to live. A friend of mine who does that on a daily basis. So this project really is to take the patient, put it in the center, and really work on issues from all the different perspectives so that we can come up with solutions that help patients feel better. To turn this apprehension into assurance relief, to turn fear into optimism, to actually promote healthy healing, to take the individual and to support them with a system that encourages well-being. We do this by going through and mapping and observing what a patient goes through and all the different interactions, and then what the physician or caregiver does, and try to see where the mismatch is. And they're glaring mismatches. So some of the projects that have come out of this work is a care map. I guarantee you that you have more experience in traveling from here to New York and understand more of what's going to go on than you do if you're going to go in for prostate cancer surgery. You have no clue. You have no clue who you're going to meet. You have no clue what's going to happen. You have no clue where you're going to stay. And they don't want you to be scared, and they want you to speak up. Unbelievable. So this student came up with this project that was basically a map of all the people who you would meet, where you could bring family members in, where you could put information, what before, during, and after when you get home. And a place to put all of this information. I don't know how many of you guys have gone in for short stay surgery or long stay surgery. You get a pack full of information. It's about this full, and I guarantee you don't look at it again. It's just impossible. So this is a way to organize all of that. Unbelievably, there was no edible healing garden at Huntsman Cancer Institute. So these students went out and found donations, found a landscape architect, and pitched it to the chief medical officer and the chief operating officer at Huntsman Cancer. We want to create a healing garden that celebrates the life of cancer sufferers and gives families and patients something to do when they're here. And that sort of celebrates this rejuvenation of life. And so they pitched it, and they got funding for it, and it'll be open up in the spring. And some of the staff members were like, well, we've been trying to do this for years. What happened? It was because they had this broad view, they listened, and they reflected what people wanted and put it into a package that was understandable and actually had some impact. This last one that I'll show is a new initiative that started from a particular student who said, yeah, the Mayo Clinic, Kaiser Permanente, they have these really cool patient innovation labs that really look at a systematic process to deliver innovation that impacts patients. So he pitched this whole idea to Jack Britton, Tech Ventures, Vivian Lee, the Vice President of Health Sciences, and he walked out of a meeting with $125,000. Unbelievable. Because he listened and saw what patients needed, saw this gap that we were talking about, and then pitched it in a way that really was meaningful. Because healthcare is not something that's delivered like a pizza. Right? It's a complex, emotional thing that really fits into this sort of design thinking. And it is not about leaning a process. It is about delivering care to the individuals that we all care about.